Hi, I'm Dr. Jeffrey Hunt of the Vein and Cosmetic Center of Tampa Bay. We have been doing varicose veins in this site for the last 24 years and have added many lasers and cosmetic procedures. And we do things that make people look better, but we've not really been doing things that make people feel better from the inside and help them metabolically. That's why we're so excited to introduce BioTE to our practice and hormone pellet replacement for our patients in order to have them feel better about themselves besides just looking better. These pellets bring your hormone levels up to the way that they were when you were 25 or 30 years old. There's several very important reasons to do this. If you maintain good hormone status, Mother Nature makes you feel your best when you're young. All your functions are better, your organ functions are better, your thinking is more clear, your joints work better, you feel better, you sleep better. Bringing hormone levels up can bring many of these same characteristics back you had when you were younger, even in ages of 60, 70, and 80 years old. And before they were using creams, and these are hard to absorb, they were using tablets and the testing wasn't as good as it should be. Now we have pellets that are guaranteed within 3% of potency. And these pellets are placed in a fatty layer just above the buttocks, and they're tiny for women, they're a little bit bigger for males, but they last for a number of months and they give steady state absorption. Some of the things that pellets can do for women is they can make them sleep better, they make them feel better, they get rid of brain fog, they make them think more clearly and precisely. They also have very protective functions and they will keep the bone strong. They protect the breast. And there are studies that show it can reduce breast cancer by 50% just by maintaining youthful levels of testosterone. They also decrease dementia. Some studies have suggested 50% reduction in Alzheimer's dementia in women and 70% in males just by maintaining testosterone levels at youthful levels. They also help get rid of belly fat and they keep your muscles strong. There are other things we do with BioTE besides just hormone levels. We also check your thyroid level. It used to be that if it was in a big range, they said you were normal. And now we know that you can have fairly normal numbers, but still be clinically hypothyroid. And you're tired, you don't have energy, your weight doesn't come off. And we found that if you maintain people in the top 1/3 of the levels and keep a T3 that's above a certain level, that people tend to feel better and they do better. Other things that have been shown in recent data is that if you maintain high T3 levels and you keep the thyroid stimulating hormone depressed by keeping up high T3 levels, that cardiovascular events are decreased in some studies as much as 70%. So we know this is very good for cholesterol, triglycerides, and the arterial system. And we also check some other things that are important, such as T3 levels, such as D3 levels with vitamins. D3 is actually a hormone, it's not a vitamin, and it's something that also works with the hormone system. If your D3 level is below 10%, they say your mortality rate is actually doubled. There's a lot of low D3 in the US and most people don't check for it. There's also a lot of low thyroid problems in the United States, and there's very low iodine. 2/3 of the population is deficient in iodine, yet most people do not test for this.
Hi, my name is Joy Drexler. I'm one of the nurse practitioners here at Dr. Hunt's office. And if you're watching this video, it means that you've decided to move forward replacing your testosterone using the BioTE method. And I'm here to explain a little bit more about how this works and what it is that we do and how we balance your hormones. The body really works together as a symphony. All the little pieces work together. And if you had a symphony that was out of tune and you only fixed one section of that symphony, the whole thing would still sound out of tune. The body's the same way. Your testosterone, your estrogen, your thyroid, and your vitamin D all work together as a symphony. So what we do when you first come in is we check the labs to see where you're at. And then I individually base your dose on these labs and everything else that goes along with it.
The symptoms that I had prior to pellet therapy were intense fatigue. I had weight gain that wouldn't budge no matter what I did, and I could not get through the day without a nap. And I had an overwhelming sense of mental fog.
I just felt terrible. I felt like total lack of energy, didn't want to do anything. I couldn't hardly get motivated to do much of anything at all. My sex drive was gone, and my hair fell out. So, it just was a bad combination.
And after my hysterectomy, I noticed very quickly, even with the synthetic hormone patch, that I absolutely felt fatigued. I didn't feel like I could run my business as effectively as I had prior to. And I felt just overall with my skin and everything that I really lost that glow that I really enjoyed.
Testosterone is actually made by both men and women. Women need testosterone just as much as guys do. Our ovaries make testosterone and estrogen. The inner portion of the ovaries make the testosterone. The outer core of the ovaries make the estrogen. And a lot of women have testosterone loss because our ovaries age from the inside out. So the testosterone is the first hormone to decrease. And this can happen 10, 15, 20 years before they ever hit menopause. With this comes a whole myriad of symptoms: depression, anxiety, sleeplessness, fatigue, can't get up and going through the day. You also have night sweats and difficulty sleeping.
She actually said to me, which actually made me feel good, that my labs for everything else except the hormones and my thyroid were spot on perfect, that she could tell that I eat well and I work out and everything else. So I should be feeling good. You know, on paper, I should have been feeling good. But then when she got to the section for my hormones and my thyroid, they were completely wrong.
What we typically do when somebody comes in, we check your labs, we see where you're at, we individually dose the testosterone and estrogen based on your labs, how old you are, how tall you are, a lot of your medical history, any medications that you're already on, and any surgical history that's applicable. And then we come up with a dose that's just right for you.
You have the blood work, you have the test right in front of you that tells you what's missing. And you have these intelligent doctors who are telling you, hey, this is what you need, and the pellet provides that, then you have nowhere else to go but up from that point.
Health doesn't just start on the outside, it obviously starts on the inside. So in order to stay feeling good, we need to really stay on track of what we're doing with our bodies, and I think that this is the absolute right approach.
I would say overall the procedure probably took about 10 minutes, and there was no pain, and within about 24 hours, I did begin to feel a slight bit of soreness, so I walked a lot that day, and that helped.
A lot of people ask me when they start to feel better. By week number 1, you're going to be sleeping better. You're going to be able to sleep through the night. The night sweats are going to start to disappear. Hot flashes are going to be better. By week number 2, brain fog starts to lift. People are able to recall nuances of conversations. Their memories are better. By week number 3, this is when you start to get a lot more energy. Libido comes back, which is nice. By week number 4, that's when you hit the peak of your hormones, and then we test the labs again at week number 6 so we can see where you're at. This way we make sure that you have a dose that gets your hormones into their optimal range.
About a week and a half after the treatment, I felt like $1,000,000. I had just left the gym, I was on my way home, and I thought, oh, it's just endorphins kicking in, no biggie. Sure enough, days later, it just continued. I just feel good all the time. It's an amazing feeling. I really can't believe that it could work this well, but it did for me.
I feel like I'm 150% alive again. I wake up in the morning and I am ready to go. I feel very alert in my conversations. I'm enjoying every little moment instead of feeling like, how am I going to get through the day?
Within a couple of days, I was surprised that when I woke up in the morning, I wasn't groggy. I was awake. And as I started to move through my day, it wasn't, when can I take a nap? It was, oh my gosh, it's 3 o'clock. I'm feeling great. And as I began to realize this energy wasn't coming from a cup of coffee, this was a real difference that had been made as a result of the therapy. And so I began walking, getting back into a normal routine, and my husband began to notice an immediate lift in my mood as well as in my libido.
My energy level is fantastic. It's right where it should be. And yeah, my sex drive has increased, which my husband loves. And it's just, it's completely different. I really do feel like I did pre-pregnancy. And I just can't believe I was able to fix it after all this time. I did a lot of research, and I went to a lot of doctors, but you know, finally when I came here, I got the solution I was looking for.
And I really feel like it's made an absolute difference in my life, and I would recommend it to anybody.
So this is the reason we're excited about BioTE, bioidentical hormone pellet replacement, and we feel like this is where the future of medicine should go in order to keep people feeling well as they advance into age.
Just to have my life back, that's a miracle.